Hi everyone, our presentation is on supporting the family and wider network caring for someone with motor neuron disease. In our presentation, we will first focus on introducing MND, discussing transition theory, and then focusing on three transitions: diagnosis, progression of disease, palliative/bereavement, followed by a conclusion. Firstly, what is MND? Motor neurons disease is a condition that affects motor neurons which instruct the muscles to move by passing on signals from the brain. They play a role in both conscious and automatic movements such as swallowing and breathing. Therefore, symptoms of MND include weaknesses in the ankles or legs, slurred speech, difficulty swallowing, weak grip, muscle cramps and twitches, weight loss, and difficulty stopping yourself from crying or laughing in inappropriate situations. Worldwide, there are 1 to 2.6 per 100,000 individuals newly diagnosed with MND, giving a prevalence of 6 per 100,000 persons. The onset of MND is typically between 58 and 60, rarely occurring before the age of 40. The disease is slightly more common in men and has a median survival time of 20 to 48 months after diagnosis, though 10 to 20% survive more than 10 years. A man who defied even those odds is Stephen Hawking, who lived for 50 years after his diagnosis of ALS, amyotrophic lateral sclerosis, which is the most common type of MND. Other types include primary lateral sclerosis, progressive bulbar palsy, progressive muscular atrophy, and spinal muscular atrophy. Only 10% of cases of MND are hereditary. 90% of cases develop randomly, and the exact cause remains unknown, though suggestions of genetics, toxins, viral, and other environmental factors may play a role. MND is a complex disease. In the advanced stages, people need assistance moving, eating, breathing, or a combination of these. The disease can become life-threatening, and breathing problems are the most common cause of death. Though individuals experience muscular atrophy and loss of voluntary control, they maintain their intelligence, memory, and personality.
Let's talk about transition now. The reason why the nursing profession is involved in transition is because nurses dedicate a significant portion of their clinical duties to caring for individuals undergoing various life changes that impact their health. According to Bridges and Bridges, transition is not an event, but rather the inner reorientation and self redefinition that people go through in order to incorporate change into their life. Among various transition theories, Malicious emerging middle-range theory is also the one which has been shown in the diagram. Patterns of transition would include whether the client is experiencing a single transition or multiple transitions. Important considerations are whether multiple transitions are sequential or simultaneous, the extent of overlap among transitions, and the nature of the different events that are triggering transitions for a client. Looking at the properties, they are not always separate or distinct from each other. Instead, they are interconnected aspects of a complex process. The various studies involving multiple transitions provided evidence that most transition experiences involved critical turning points or events. Critical points are often associated with increasing awareness of change or differences or more active engagement in dealing with the transition experience. Moreover, when assessing transition experiences, it's crucial to acknowledge the potential for change and variation over time, which might require re-evaluation for outcomes. To understand the experiences of clients during transition, it is necessary to uncover the personal and environmental conditions that facilitate or hinder progress towards achieving a healthy transition. Personal, community, or societal conditions may facilitate or constrain the processes of healthy transitions and the outcome of transitions. A healthy completion of transition is determined by the extent to which individuals demonstrate mastery of the skills and the behaviors needed to manage their new situations or environments of transition. If outcomes are considered too soon in a transition process, they may be process indicators. Likewise, mastery in having a new sense of identity reflected healthy outcomes of the transition process. Types of transitions encountered by nurses when interacting with patients and the families have been identified as developmental, health and illness, situational, and organizational. We're going to exclude organizational here because our topic is more focused on patient and the family. The examples of different kinds of transitions can be seen on the table. Lots of patients with motor neuron disease might be going through developmental and situational transitions, along with health illness transitions, making it a complex case. We have categorized health illness transition process experienced by patients with motor neuron disease into diagnosis, progression of disease, and palliative, which will be explored in detail in next slides. Transitional problems may result from not being able to separate from past identities and ways of functioning. Problems may also result from the inability to make decisions as to which path or route to take, or from difficulties in abilities to make decisions. Some of the nursing measures to overcome transitional problems are preparation of transition through education, which requires sufficient time for the gradual assumption of new responsibilities and implementation of new skills. The second one is specially created environments for preparing patients and families or wider networks for transition. Third one is role supplementation, which includes alternative new roles or new groups that might make an appropriate role supplementation to role changes brought by developmental, situational, and health illness transitions.
Next, I'll introduce the first transition period. What kind of difficulties they face during the initial diagnosis phase? I divided the discussion into two groups. One is disease occurs in childhood, and their parents will be considered as well. The other group is young adults, and we start with children, a grief process that children and their families may go through after a diagnosis. Children and their parents express dissatisfaction with the way were communicated by medical staff and felt they received insufficient information. They are concerned about the loss of function, fear for future, and the relationship change between family members. However, information provided by medical staff only focus on disease symptoms and progression. In addition, research shows that many people have received incorrect information and misconception. Many people worry about the genetic status, but most MND diseases are not hereditary, and the challenge for the family carers are lack social support and services. Caring responsibilities limits their own social circles and activities. Many parents experience ongoing fatigue and emotional stress. The second group is patients who first diagnosis in young adulthood. From a study exploring MND patients' employment participation, they found that many people tend to deny their condition and the challenges. Many patients feel that they are frustrated because colleagues and supervisors are not necessarily sympathetic to public attitude about the disease. Lack of peer support forces them to hide. Delayed disclosure at work may continue for years, as long as symptoms may be hidden. However, experts were not consulted and they couldn't foresee the benefits of opening up. They lose their chance to support daily function or other appropriate interventions are delayed. The following transition period they may face occurs when their disease has clearly progressed. Firstly, most people choose to retire early out of fear that others will view them as worthless. This has a big impact on the economy for family. Also, they will be ashamed of it and need to alter their self-perception. Secondly, they try to strive for independence as long as possible, but dependency arises as age increases, as their physical strength declines faster than normal aging. However, their spouses' siblings begin to experience similar disabilities. This makes the burden of family care even greater. So, the social resources and network support are necessary during this period.
After the discussion of two transitions, we summarize the top 5 concerns from families who carry MND patients, and this list we list in order from the initial diagnosis to the progression of the condition. The first concern is what to expect in the future, because the family often experience the uncertainty and seek information about the treatment option, symptoms, and the rehabilitation. The second concern is whom they can contact if they encounter the problems and who can provide them with the support and the advice. The third concern is where they can have equipment to assist in the care, because the gradual decline in motor function leads to concern about the accessing resources to equipment. And the fourth concern is how many family members to dealing with their feelings and worries. And the last concern is have time for themselves during the daytime, because the family may struggle to find them to rest, and how we can support them. From this, we can see there are lots of healthcare professionals will involving to caring MND patients and their families, such as the GP, neurologist, psychologist, palliative rehabilitation, and each professional should collaborate with each other in order order to comprehensively understand their needs and provide the care, especially a neurologist. They can provide the information about the diagnosis, prognosis, and the management of MND. So it is important to consult with the neurologist to the MND family. And from this diagram on the right side, it illustrates the range of the service involving in caring for people living with the MND. And in the center of the circle is the healthcare professionals, but expect the professionals. The wider network in communities is also important for the families, such as the social workers and district nurses, voluntary services, and the respite care. And the role of the social workers and district nurses to the family is helping them to connect with the support group. And the support group can provide the setting to learn from other carers and gain social support and direct assistance. And one study indicates that if the family can connect to the support group, can improve the relationship with the family members due to they can reduce the caregiving burden and also improve the overall patient well-being. And the voluntary service such as the MND Association in the UK, they can provide a considerable service such as the equipment, financial and communication aids. So it is important to provide this kind of the voluntary services to the family who living with the MND patients. And especially health professionals. The early link to the palliative care is also important to the family members because the progression of the disease is unavoidable. So the palliative team can provide about the symptom management. So now we are going to talk about how palliative team can provide the support to the family members.
Even at the initial point of diagnosis, which would ordinarily be considered an early stage for some conditions, and without the need for immediate consideration of palliative measures, the implementation of anticipatory palliative measures is crucial in the case of MND, as the condition will have profound detrimental effects on one's comfort and eventually lead to death. Other than the patient's family, there are many parties involved in the wider network at the end of life stage for patients with MND. The palliative care team can consist of social workers, organisations such as the MND Association, and hospice staff such as Marie Curie nurses. There are many psychosocial implications for families and the wider network when managing care for an individual with MND, such as a sense of loss, changes in identity and relationships, low self-esteem and fear of loss, which can all have a profound effect on the well-being and quality of the patient's support system. Family members and support networks can also often lose their sense of identity through a caring role, as social death can occur through psychological strain and a lack of social life beyond working and caring. A fear of loss can also cause families and the wider network to isolate themselves from or engage in conflict with their peers, resulting in severed relationships as differing perspectives regarding care and personal matters arise. Personal relationships with the patient can also be diminished due to the debilitating nature of the condition and the patient not being perceived as who they once were. Organisations such as the MND Association and Marie Curie can help to combat these issues by offering a holistic, person-centred approach to the patient, whilst also aiming to offer support to the family and ease the burden of caring on them. Both of these organisations and those similar to them provide advocacy, equipment including digital and assistive technologies, information, education, practical and emotional support as well. Marie Curie can also be solicited to provide nursing care for patients with terminal illnesses towards the end of their lives, and so they are often consulted relatively early on a patient's MND journey to liaise on matters such as care planning, which includes interventions to employ and which anticipatory medicines may be needed, as well as specialist guidance on what to expect. At the time, they will also guide the family through the bereavement process. At the stage of bereavement, a patient's care network may find themselves experiencing trauma, mood swings, and loneliness. The holistic care provided by organisations such as Marie Curie can then be shifted towards the family, offering guidance on funeral planning as well as the bereavement process in itself, helping them to understand their complex grief better. Grief is quite complex and can be separated into 5 stages. First, denial, anger, bargaining, depression, and acceptance. And as such, it is important to be patient with the patient's peers throughout this process, as the road to recovery is often a long one. That concludes our presentation on supporting the family and wider network of the patient with MND. We have discussed diagnosis, progression of the disease, and palliative care. Thank you for listening, and here are our references.